This is the Limelight.
Assalamu alaikum, hello and namaste. Welcome to another episode number 42 of the Limelight. Well, today on the hot seat, I have a smart and beautiful lady. She's a physician and a diabetes specialist. So, listeners, please welcome our guest, Dr. Shilpa Dheeraj.
Hello, everyone. Good afternoon, good evening. Assalamu alaikum. Glad to be on the show. Thank you, Pari, for giving me this opportunity.
You're welcome, dear. It's a pleasure to have you on the show. So, Dr. Shilpa, before we go into more about the things I want to know about diabetes and treating diabetes, can you just tell our listeners about your personal life?
I'm a mommy, first of all, and I finished my MBBS and my MD in medicine, followed by a fellowship in diabetology at CMC Vellore. I am born and brought up in East Africa, Kenya, Nairobi. It's where my heritage is and will always be. But I've been settled in Bangalore since 2003, and I'm loving it. Yeah, I love my job, both as a mom and as a doctor. They go hand in hand.
That's really lovely, and I wish and I pray that God gives you and your family all the health, happiness, and life.
Thank you very much. It's a very sweet thought. Thank you so very much.
You're welcome, dear. So, doctor, tell us what is your specialization?
So I've done my MD in medicine. That is to say that I can treat most of the medical disorders that happen to occur. But I did my further specialization in the form of a fellowship in diabetes at Christian Medical College, Vellore, one of the most coveted institutions in India. I had a 1-year course, especially being trained in diabetes and how to deal with complications with relation to diabetes, food problems especially that not many people do talk about, but is very prevalent, and also young diabetes, which is becoming very, very common.
Yeah, right. And can I know why did you choose this specialization in diabetes?
Okay, well, it's a very broad disease. It accompanies any other disease that comes by. And in India, India is the second capital of diabetes in the entire world, first being China.
Okay.
So it's something, of course, in amongst Indians, we love to be first in everything. This is the one thing that we shouldn't be happy about.
Yeah, right.
Being a common disorder, and I mean, it's become a household thing now. Almost every second person I know has diabetes. And I think the care is not going to be enough with just a physician, with the number of physicians that are available. We need a little bit more helping hand. Endocrinologists are very busy with other hormonal problems as well. So this is kind of an in-between between just medicine and endocrinology, which is the study of hormones, so to speak.
Okay.
So that's what piqued my interest actually, that I should be able to help out with anybody who has diabetes and diabetes related complications and prevention of it mainly. Yeah.
Okay, that's nice.
Yeah.
So, Dr. Shilpa, can you tell what are the symptoms of diabetes?
Sure. So initially, when an individual comes up with high sugars, usual manifestations or the usual symptoms are that they need to go to the bathroom more frequently to pass urine. They feel very tired. They feel very hungry. They feel very thirsty. Also, weight loss is a very common complication, or a very common symptom rather, that we do come across. Other than that, in young children, failure to grow adequately, sudden weight loss, recurrent infections, these are the things that can tell us that yes, the sugars need to be checked and looked into, so that we need to confirm that it's diabetes or not, and investigate further.
Okay, right. How frequently we have to check for our diabetes?
Well, it depends on what kind of job you do, how active a lifestyle you lead, as well as your predisposition to. So, if you have a first degree relative, so to speak, an aunt or an uncle or a mom or a cousin who has diabetes, that means your risk of getting diabetes is also quite high. So, once in a year, check on a fasting blood sugar level and an after food blood sugar level is always helpful. On the other hand, when in between, whenever you are symptomatic, anytime beyond 30 especially, I think getting a yearly or an annual checkup on a blood sugar will not cost you anything, and I think it's well worth it. In children below or in individuals below 30, only if symptoms come, you can maybe look into it. Other than that, below 30, it's very uncommon for it to manifest unless it has symptoms.
Okay, so now if in case we have a diabetes, and can it be controlled with exercise and our regular eating habits?
Definitely part of the management of diabetes, I would say up to 60 to 70% of the management of diabetes should entirely depend on exercise and diet.
Mm-hmm.
So when I say that, I usually use metaphors with my patients and I tell them diabetes is like a chair. It
Okay.
has four legs. One leg is exercise,
Mm-hmm.
the other one is diet, another one is checking your sugars regularly, and the fourth one is taking your medications adequately. So what happens if one leg gets wobbly? You
Mm.
topple over and the balance gets thrown over.
Yeah.
So everything should go hand in hand. It's very important to maintain a correct diet. That should mean a three meal, three snack that is frequently advised by a treating physician.
Mm-hmm.
Small meals, frequent meals are very, very well recommended and very good in treating diabetes. And at least half an hour to 40 minutes of exercise on a daily basis after fueling up on a snack, of course, is very, very important.
Mm.
Um,
Okay.
Diet would probably just mean that you can just cut down on the amount of carbohydrates in your diet and just increase the amount of vegetables, fiber, and proteins. So to speak, being Indians, we love our rice. If
Yeah.
an individual can maybe cut down on rice by maybe half and increase the amount of vegetables on their plates,
Mm-hmm.
that would make an immense difference to their diabetes at meal times.
Mm.
On the other hand, cutting down on fruits would be very important. You can have a fruit, but preferably between meals or 2 hours before a meal, like
Okay.
maybe 2 hours before lunch or 2 hours before dinner.
Mm-hmm.
That would be very helpful rather than eating a fruit right after food.
Okay.
That is a usual habit.
Yeah.
And frequent snacking, basically, and regularly checking your blood sugars, it should be good to manage that way. When I talk about exercise, the frequently exercise that is recommended is walking
Mm-hmm.
or jogging. If you're interested, swimming is a great way to maintain your lifestyle modification because you exercise all of your body.
Right.
But other than that, any other form of exercise, floor exercises, gymming, treadmill, anything is good as far as you get your body going after a snack, not on an empty stomach.
Okay. Right. Dr. Shilpa, can you just suggest few things what a diabetic patient can do or should not do during Ramadan?
Sure, an individual with diabetes is also, of course, part of the family, and I can imagine how difficult it would be to cook separately for this individual. And it shouldn't be that way. You should be able to eat everything that everyone else is eating.
Mhm.
It's just that I suppose you can probably invert the dose of tablets that you usually are taking. Of course, this would be after confirming that it's okay with your treating physician.
Mhm.
So what we usually suggest is that we invert. So the morning tablets can be taken in the evening and the evening tablets to be taken in the morning. Same
Mhm.
with the insulin dose. And secondly, the food intake, again, if it would be difficult or if you are predisposed to low sugars, in the sense if during the day you have sweating, your heartbeat is very high, or you feel the heartbeat abnormally high,
Mhm.
or
Okay.
if you have a lot of hunger, or you feel giddy, or you're about to faint,
Mhm.
please, I would suggest you can go ahead, break the fast, and you can take some sugar because that would be more deleterious on your health. You can always do the fast on some other day, I
Mhm.
suppose, right? And
Right.
another thing is checking your sugars frequently during the month of Ramzan is very important because you don't want to fall ill during the month of Ramzan. You want to continue doing your
Yes.
fast and celebrating. So
Right.
you want to check your sugars more frequently. In case they're going up, you can meet your treating physician and
Mhm.
take further treatment from them.
This is
That's it.
actually really helpful because as Ramadan is coming close, people, women, and
Hmm.
you know, they'll get help from this.
Like I said, diabetes shouldn't rule your life. You should rule over the diabetes.
Yes, exactly. Right. Doctor, now I have something interesting segment for you. It's
Uh-huh.
different than the questions I asked. It is the rapid
Oh,
fire round.
wow. Okay. I'm scared.
I have four random questions, and you can
Oh,
answer that in one word or a sentence. Okay?
okay.
Yeah. Okay. The first one is which is your favorite movie?
Dilwale Dulhania Le Jayenge. Yeah, I think that's one of my favorite of all time.
That's nice. It's a nice movie. Okay. Tell me which is your favorite dessert?
Chocolate, anything chocolate is decadent. Anything dark chocolate is even more decadent than chocolates.
Okay, good. I thought as you are a doctor who is treating diabetic patients, I thought you have left sweets or desserts.
No, no. Do you know chocolate is very good for diabetes?
Oh,
I'm not talking
okay.
about the sweetened chocolate. I'm talking about the dark chocolate.
Ah, dark
Two
chocolate.
pieces a day.
Mm-hmm.
2 pieces a day of about 70% cocoa can reduce the insulin resistance and improve the treatment of diabetes. Yeah.
Wow, that's really
And cheating
interesting.
is good for some time. Like, everybody needs to cheat on a diet from time to time. You need to live life apart from,
Yes,
you shouldn't allow diabetes to take over your life. You should
true.
be able to, hold the harness on diabetes and cheat from time to time.
Yeah, exactly. I agree on that. Okay, the last question.
Okay.
If you could relate yourself to a superhero, who would it be?
So this is a difficult one. I don't know, maybe with regard to ambition, if I can think about Priyanka Chopra and think about how she's had so many hurdles along her way and she's still going at it without thinking
Okay.
and looking back about what people are talking about her.
Mm-hmm.
I think maybe to a really tiny, tiny little wee bit of extent, yeah, maybe her.
Okay.
Since you asked me the question.
Well, she's good and she's really hardworking and she cares a damn about anybody.
Yes, she is.
Yeah.
I love that attitude. I think it
Yes.
makes the whole world, I mean, it makes a difference in the whole world, yeah.
Yes, true, true.
Yeah.
Okay, that was the end of the rapid fire round.
Right, right. It was that was not bad at all.
You did
Yeah.
great. I think you got
Thank you very
scared
much.
with the,
Yeah.
with
I did, because we usually think about Karan Johar and his rapid fire round, and you know how controversial that can get.
I know,
Yeah.
I know. Oh,
Lovely, lovely. It was a lovely round, yeah.
oh, thank you. And you did great. Amazing.
Thank you. Thank you very much.
You're welcome, dear. So now we have reached the last segment where we ask your advice for our listeners.
What I would say is just get healthy. At least 6 days in a week or 5 days in a week. Try
Mhm.
to keep doing some exercise. If you cannot find time, I know a lot of you are moms out there listening to this podcast, and it's excellent. I've been listening to it as well. But make some time for some kind of exercise. Take the stairs instead of taking the lift or the escalator. Try to walk around in the mall more.
Yeah.
Try to eat healthy. Try to get your children to have breakfast. I think breakfast is a very important meal of the day.
Mhm.
Skipping breakfast could be deleterious. So get that habit into your kids as well, that having a good protein filled heavy breakfast in the morning is like fuel for the rest of your day. Your rest of the day is going to go great.
Yeah.
Eggs or a good amount of fruit in the morning, good amount of fiber in the morning. It makes a lot of difference. Yeah. And just be healthy, but cheat. Learn how to live life as well. Eat
Mhm.
chocolates. Be lazy from time to time. I think it's really important to take those cheat days off as well.
Yes, right. Be active as well as give yourself a good amount of fun.
Yeah, 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 definitely. Yeah.
Right. That was a spot on advice, Dr. Shilpa. I loved every bit of it. And
I enjoyed this too. Oh, wow.
I really thank you for taking time. I know you're busy in clinic, kid, and going to hospital rounds and everything, but thank you for
That's
making
fine.
time for this interview and giving so much knowledge to us.
I absolutely enjoyed this as well. I would take out time for this anytime, any day, anytime you need me. I'm always here available for any help that you need.
Thank you so much. Thank you so much, Dr. Shilpa.
It was such a pleasure talking to you. It's such an honor.
Thank you. Same here. Same here.
Thank you.
Thank you. Okay, listeners, if you have liked this interview, please click on the like button of the Limelight page. And if you want to get in touch with Dr. Shilpa, you can check for the details at the poster of this interview. So, thank you for listening and Allah Hafiz.
Thank you. Bye bye, listeners.